Leucorrhea. In this topic, we are going to cover the definition of leucorrhea, criteria to term leucorrhea, the pathophysiology, which includes the cervical cause and the vaginal cause, the diagnosis, and the treatment. Definition of leucorrhea. Leucorrhea is strictly defined as an excessive normal vaginal discharge. It is subjective with individual variation, while to declare it to be normal and not an infective one, it requires clinical and laboratory investigations. Leucorrhea should fulfill the following criteria. The excess secretion is evident from persistent vulval moistness or staining of the undergarments, which includes brownish yellow on drying, or need to wear a vulval pad. The second one, it is non-purulent and non-offensive. Third criteria, it is non-irritant and never causes pruritus. Abnormal vaginal discharge is further classified as non-infective, infective, neoplastic, and foreign body. Under non-infective, it further results in leucorrhea only if it is non-purulent, non-offensive, and non-irritant. Further, leucorrhea is classified into vaginal cause and cervical cause. Now let's see the pathophysiology of leucorrhea. Normal vaginal secretion depends on the endogenous estrogen level. With increase in EEL, that is endogenous estrogen level, there is abundant secretion of the endocervical glands and the superficial vaginal epithelium becomes rich in glycogen. Mucoid secretion from the cervical gland is normally small in amount. The carbohydrate radical of the glycoprotein mucin is split off and fermented into lactic acid. However, if the mucus is secreted in excess, it pours out at the vulva. Excessive secretion due to cervical cause may be seen where there is non-infective cervical lesion which may produce excessive secretion which pours out at the vulva. Such lesions are cervical ectopy, chronic cervicitis, mucus polyp, and ectropion. Second one is vaginal cause. Increased vaginal transudation occurs in conditions associated with increased pelvic congestion. These conditions are uterine prolapse, acquired retroverted uterus, chronic pelvic inflammation, etc. Ill health is one of the important cause of excessive discharge. Under diagnosis, let's see the evaluation part. This is divided into history, physical examination, and investigations. The history includes symptoms, discharge, the duration of discharge, if there is itching, if there is dysuria, dyspareunia, and pelvic pain. Along with that, contraception, sexual behavior, and if there were any other previous similar episodes. Under physical examination, we have ill health, poor nutrition. Abdominal examination includes checking for mass and tenderness, vulval inspection for discharge characters, and genital ulcers. Speculum examination that includes pathology, cervix, vagina, and for tenderness. Pelvic examination check for tenderness, pelvic mass, and a foreign body. Treatment includes improvement of general health. Cervical factors require surgical treatment, for example, electrocautery and cryosurgery. Pelvic lesions producing vaginal leucorrhea require appropriate therapy for the pathology. Pill users may have to stop the pills temporarily if the symptom is very much annoying. Above all, local hygiene has to be maintained. Treatment for specific infection.